Welcome back to Suncoast FYI. Dental health is much more important than you may think. Without healthy teeth, there's a greater risk of having a heart attack, stroke, high blood pressure, and more. Dr. Stephen J. Feldman joins us now to talk about his practice and how important dental care health is. And good morning, doctor.
Good morning.
Thank
How are you?
Good, good. Thank you for being here.
Well, thank you for having me.
Could you tell us a little bit about who you are and when you started your practice here locally in Venice, I believe?
I'm a dental specialist called a periodontist. I was trained in Boston at Tufts, and I've been here for about 40 years in Venice. And we've been here so long, and the community has done so much for us. We thought we would begin to give back.
Okay.
So I know the reason I'm here is for the charitable giving that we're doing, and we're very proud of that. And it's beyond what we thought it would be. So.
Can you tell us why you started it, and why is it beyond what you ever imagined it could be?
It was a hardship for a lot of patients, not necessarily financially, but that did have an impact for people to come in when they were terrified of what was wrong with their teeth. And if we did, they'd have to pay money for the advanced diagnostics like 3D CAT scans, so on and so forth. And it was terrifying for them to spend that taking the risk, and they already thought they were so impaired that they wouldn't be able to be helped. And the reason I did the charitable giving campaign where they would give just $100 to one of our 7 charities was because it would allow them to come in, get what they wanted virtually for free. They have a deduction, and they weren't obliged to do anything. If they did go forward with care, then I would donate another $100 to that same charity. And you'd think, well, geez, I was losing money. And it seemed like we were, because in 9 months we've given about $50,000 away.
That's wonderful.
It's amazing.
That's amazing.
But what's really happened is patients are coming in with a different feeling, with a different attitude. They're not really judging me or asking me who am I, because they know who I am. Where the charitable giving allows us to put on a face which is true of generosity. And instead of charging them their $550 or about for all their diagnostic needs before we even go forward, it simplified it.
Great.
It simplified it, and my greatest skill really is my diagnostic skill. So I'm proud to do it and happy.
So once they have the diagnostic treatment done, I mean, you're honest with them. You tell them whether what they have is okay or whether they need to go forward. And if they do, I know there's options for tooth replacements and implants. Can you tell us a little bit about how you decide on what is best for your patient?
Well, before implants, which is before 1985, 86, somewhere in there, that's when clean room technology came to the world, and you could get sterile products, packaged sterile products that you normally would have to sterilize yourself, and that's why there were so many implant failures before that. So the normal tooth replacement would be a permanent bridge where they'd cut down perfectly normal teeth to replace the missing teeth, which many, many people have, or a partial denture or a denture or something like that that was somewhat either uncomfortable or not quite as stable, as solid as normal teeth. When implants came along, you could replace the tooth with something which was as solid, which was to the brain mimicking the actual tooth.
Okay.
So we could replace teeth finally.
That's wonderful.
Yeah.
And that's, again, like you said, it's cutting edge, and you've been using laser, you've been using 3D technology to come up with what you need to do that best serves the patient. And I think that's just an amazing technology that I'm so pleased to hear that you're doing. Now,
everybody gets it.
Yeah.
Everybody gets it. In other words, they understand it, and everybody gets it. In other words, we give it to everybody.
Wonderful.
Yeah.
Now, I know that there's a lot more details that we could go into. Right now, what I would like you to do is tell our viewers where they can go to find out more information about not only you and what you do, but the charities that you do give to when they come and see you.
When you come and see us, we have 7 charities. I'll read them. They're the Boys and Girls Club of Venice, Tidewell Hospice, United Cerebral Palsy, Salvation Army of Venice, All Children's Hospital Foundation, Catholic Charities of Venice, and the Chabad of Venice and Northport. And they all pick something.
Wonderful.
And
okay.
it's just, it's the best thing we've done.
Awesome. Okay.
it really
Can
is.
you tell us your website, please, and a phone number that our
The
viewers
website
can
is,
reach you at?
I don't even think I know it. I think it's Dr. Stephen Feldman, DDS.com.
Okay. And your phone number?
The phone number is 941-485-9633.
Great. Thank you for being here, and
you.
I appreciate all the help that you give our local community and their charities.
Well, honestly, it really is our pleasure.
Awesome. Thank you.
Thank you.
Stay tuned to Suncoast FYI. We'll be right back with breakthrough results.